this, emergency departments in Tarrant County, they have already seen more people reporting flu symptoms than they did during the worst week last season. As our Jason Allen reports for us live in Fort Worth tonight, the strain of flu that affects more people is also now on the rise. Jason?
Ken, flu A cases started to climb in that week up to the Christmas holiday. That's here. And they say when people head back to work and school in the next week to 10 days, those cases could start to spread even further. A flu season that started with an earlier than normal spread of the strain that affects children could start to affect a larger part of the population. Health officials in Tarrant County said their next report will show cases of influenza A have doubled from 20% of reported cases to 40%.
And it's flu A that usually gives us the big peak. So it's possible we'll get more flu A and we'll have even more flu here in the next couple of weeks.
The spread is hard to predict, Chief Epidemiologist Russ Jones told us, but the impact is starting to be more evident at area medical centers too. Emergency department visits for flu symptoms have now climbed to 8.9% in Tarrant County. That's higher than the peak number for the last flu season. Also on the horizon is the return to work and school following the holidays. Jones said reports often initially show a small drop in cases in January because people have been more isolated, but that can rise fast once everyone gets back to their routine.
When they were at home, in those pockets with families, grandmom, aunts, uncles, they were getting sick. Yeah. All right? And so you have that isolated thing. Then when the kids come back to school, those who bring it back to school are coming around other susceptibles, and it explodes from there.
Tarrant County has now had 2 children die from the flu this year after going several years without one. A state report said the most recent case was a 4-year-old child who had not been vaccinated. Live in Fort Worth tonight, Jason Allen, CBS 11 News.